Stroke recovery with THERAHAND. Hi guys! Welcome back to another educational video from Dr. Rehab. If you enjoy rehab content like this, don't forget to hit the like button. It really helps the channel. In this video, I'm going to show you a very useful tool designed to help improve hand range of motion, especially for patients recovering from a stroke or experiencing reduced hand function. This device is great for practicing different types of movements, including grip and pinch. One of its key features is the interchangeable attachments. Each one targets a specific type of movement. As the patient progresses through these steps, they gradually build up their ability until they can perform the final movement completely independently without any external assistance. If you or someone you know is on a rehabilitation journey, this tool might be a great companion for recovery. Here, you can demonstrate how it works. This device is about 18 centimeters in length, width, and height. It can be fixed securely onto a table using two screws. Each of the attachments can be easily mounted on the device, and swapping them is very simple. Cylindrical grip, supination, pronation. Basic grip training, supination and pronation. As you can see in the video, this attachment is designed for a cylindrical grip. The patient holds the handle with all their fingers and palm, and gently moves the hand back and forth, like turning a doorknob, to work on supination and pronation. Wrist flexion, extension with grip. As you see, this attachment works on the cylindrical grip, but the focus here is on wrist flexion and extension. Even if the patient doesn't have a strong grip yet, they can still slide their palm along the handle to practice that back and forth wrist movement. Finger placement attachment. Let me know in the comments if you or someone you know would benefit from this tool. I love hearing your stories. In this attachment, the fingers go carefully into the small holes on the plate. I helped position the patient's hand myself to make sure everything was aligned. Depending on the patient's condition, you can place either the middle or end part of their fingers inside. Then, ask the patient to gently repeat supination and pronation movements. This tool also comes with an adjustable tension screw. You can make the movement easier or more challenging depending on the patient's ability. On the easiest setting, the attachment moves very smoothly. But when you increase the resistance, the patient has to use more muscle effort to complete the motion. This helps engage the muscles more actively during the exercise. Spherical grip, holding a ball. This attachment is used for a spherical grip, like holding a ball. Here, the MP and IP joints wrap around the ball, activating both flexor and extensor muscles in coordination. For patients with spasticity, this movement can be quite challenging, especially because it's hard to keep the extensors active during the grip. So if you have any level of spasticity, it's best to do a full upper limb stretch before starting this exercise. If you'd like to see more tools and training ideas, don't forget to follow for upcoming videos. Keypad pinch, train the thumb and stabilize the wrist. The next one is the keypad pinch, and as you can see in the video, the thumb plays a major role here. There's also some rotation of the forearm involved, supination and pronation, and it's a great exercise for improving wrist stability too. Make sure to watch the patient closely during this movement. Due to weakness in forearm rotation, they might try to compensate by rotating the shoulder instead. But don't worry, with practice, they'll improve and perform the movement properly. Disc grip in 3 sizes: small, medium, and large. This attachment involves gripping a disc, and it comes in 3 different sizes. At first, small disc. For the small disc, the patient should try to place the fingertips around the edge. In this case, the patient couldn't position the hand correctly at first, so I helped guide the hand into place before starting the movement. Not just strength, sensory training matters too. Just a quick note, lack of muscle strength often makes gripping difficult, but sometimes a loss of sensation can make it even harder. So, in patients like the one in this video, it's important to work not just on strengthening the grip, but also on improving sensory awareness. I'll try to share some sensory training exercises in upcoming videos, so stay tuned. Medium disc, more challenge, more opening. The medium disc is more challenging than the small one because it requires the hand to open wider. Overcoming spasticity is key here, so it's something to keep in mind while working with patients. Large disc, max opening and functional hand use. The large disc is the most challenging of the 3. It requires maximum hand and palm opening, and ideally, the fingertips should rest in the grooves on the disc. If that's too hard, the patient can use any type of grip that works for them. But remember, if a patient can perform this movement properly, their hand is already quite functional, and they can handle many daily tasks independently. Shoulder matters too. Complete upper limb training. Throughout these exercises, the shoulder is also actively involved, because the upper limb needs shoulder control to move effectively. Changing attachments, quick and easy. Switching between attachments is super easy, just like you see in the video. You simply loosen the 2 screws holding the current piece, remove it, place the new attachment in position, and then tighten the screws to secure it. That's it. Thank Thank you for watching. I really appreciate your time. See you in the next one.